Hello, beloved. How are you doing? Thank you so much for tuning in. I know the weather is so bad out there, and boy, I nearly turned back and went back home. But you know what? Because I love what I'm doing and I do what I love, I had to make my way to the studio. So I hope you're all doing well. And you know what? It's always good to be cheery. I know the weather is really, really bad. And I thought because of Father's Day coming up, in a week's time, it will be good to discuss something that affects our fathers so they can actually be aware of their health situation. And with me in the studio is none other than Dr. Charlie Easmon. Thank you so much for coming,
Hi,
Charlie.
Linda.
How
Pleasure.
are you doing?
Very good, thank you.
Thank you for honoring my request.
My
Thank
pleasure.
you so much.
Okay.
Today we are going to be talking about two of the diagnoses or two of the illnesses that I think affect a lot of men here in the UK. Not only in the UK, of course, worldwide. And it's mainly, one of them is mainly Afro-Caribbean men. And that is going to be prostate cancer. And then we're also going to touch on diabetes and touch on a little bit of sleeping problems if we have time. And you know what? I brought the best in the industry who knows everything to do with men's health. And I know some of you called me and said you were scared to call in, and you texted me a few of your questions, which I will put forward, of course, to Dr. Easmon to be able to answer that. So, Dr. Easmon,
Hi, Linda.
how are you?
Very good, thank you.
So, Father's Day coming up. I thought,
Yeah.
you know what? It's good to talk about men's health.
Yes. Yeah.
Because, men are not like women who like to talk about their problems.
Absolutely.
So they're very reserved.
Yeah.
And I know I've got a few family members as well who have suffered from prostate cancer.
Yeah.
And I thought we address the issue and talk about the symptoms,
Yeah.
the treatment, and
Okay.
how people can,
Absolutely.
know what it is.
Yeah. Well, one of the big differences between men and women is that women interact with health services whether they want to or not. Because
True.
they're going to have a baby, they're going to have a period, they're going to have a cervical smear. So there's always a chance for a medical person to say, oh, what about this, what about that?
Yes.
Now, a man can reach the age of 50, 60 and have virtually no interaction
But why is
with
that?
medical services. Because the men assume that they're fine. One of the interesting things, you talk about Father's Day. We know that men who are married or in relationships have better health than men who are single, partly because the partner usually nags them
To go,
about
yeah.
their health. But anyway, so one of the things about prostate cancer is it's a silent cancer in many
Yes.
ways, because the prostate is an organ hidden away.
Yeah.
Basically, you need surgery to get access to
Yes.
it. So it's not something that you would know anything about.
But
This-
wouldn't there be any kind of signs that they can tell? Probably?
Absolutely, yeah. So cancer, by definition, is a disease where there's proliferation of cells abnormally, and in that process, it often leads to weight loss and other symptoms or feeling unwell, but that's quite late in the stage. So what we advocate is some form of earlier screening or earlier awareness for
Okay.
men. So the options we have are limited, but some can be useful. So the first thing is if a man gets symptoms of bladder changes, for example, going more frequently to the urine, getting up at night, that might be a sign of an enlarged prostate.
And enlarge.
Yeah.
When you say frequent going to the bathroom, how frequent are we talking?
Yeah, I think, if you need to go on the hour or every 2 hours,
Okay.
or within a short time of, say, having a beer, you have to go straight there. The guys who have the problem know they have the problem.
They know,
There's an
okay.
expression, the tap is on. So they're the guy who keeps having to nip out every 30 minutes almost because they
So
need to go.
obviously, if they start experiencing those kind of symptoms, then they need to go for a checkup.
They need to go for a checkup because it won't necessarily be cancer, but it might be what we call benign enlargement of the prostate.
Okay.
And that can be relieved by surgical operation.
All right. I know men are very wary about being touched or anything. So what
Yeah.
are the kind of treatments? I mean, the kind
Yeah.
of the tests that they actually offer. in
Right,
the
sure.
hospital?
So, obviously, one thing that not many people like is a rectal examination.
Of course, of course.
But so the doctor puts on a glove and examines the prostate, but
Yeah.
that gives you a clue as to whether there's enlargement or not.
Okay.
But you don't have to have that. The other thing is that we don't have yet a definitive test for male prostate cancer. We have a test that is good but not fully adequate, and this is the PSA, it's called, the prostate specific antigen.
PSA. Okay.
Yeah. The reason it's not a perfect test is twofold. One, it can be high, but that doesn't mean you've got cancer. It can be low, and that doesn't mean you don't have cancer.
Oh.
But what's important is the trend. So if you start
And
a
how
test,
often would you have the PSA?
yeah, probably about a yearly, from
Okay.
I'd say at least from 50 onwards. So at least if you have it as a yearly one, and it's going upwards, that gives the doctor a clue that you might have a problem. Once
Okay.
they've got that clue, then they want to do more investigation,
All right.
such as something called an MRI, magnetic resonance imaging. I was recently at Guy's Hospital myself. I've had an MRI done there and appropriate investigation, so they've done a good job for me so far.
Wonderful. So at least you can encourage the men to do that.
Absolutely.
It's very important.
Yes,
you know?
it's crucial. And the thing about prostate cancer is if it's detected early, it can be treated,
Okay.
and the prognosis can be quite good. There are problems. A small percentage of men will have a problem with incontinence after either treatment or surgery. A
Okay.
small percentage of men will have problems with impotence. And obviously, you know, no man willingly wants to give up his vigor. But
No.
you've got to balance the risk, which is small, I'd say
Yeah.
less than 2 or 3%, versus the cancer, which is going to kill you
Of course,
anyway.
of course. But then, you know, when you talked about having the MIR at our Guy's Hospital, but that will be at a later stage, or?
Yeah, okay, so basically you see a clinician, so a specialist, a urologist, as opposed to a neurologist, so it's a urologist. Now, the urologist has to make the decision based on the evidence that's presented to you. So they ask you to fill in a questionnaire, which covers issues about frequency of urine and everything else. And actually, at the bottom of the questionnaire, it says, could you live with your symptoms, more or less, right?
Okay.
Because some people just say, okay, I can live with
Yeah.
that. But if you can't live with it, then they offer you intervention and further investigation.
Right. Now, I've got a question from I think Ike and Mike. And like I said, people are so shy, they don't want to call in.
Of course, yeah, no, that's not a problem. Yeah.
And his question was, how often should you have your prostate checked from the age of 40?
Yeah, I think 40, maybe at least 2 times between 40 and 50, and that you could have a PSA done. Now, if your GP is not willing to do it, you may have to go privately.
Private, okay.
There have been situations, especially with black men, where they've introduced a PSA test at the barbers.
Oh, is it?
Yeah, which is a good initiative, you see.
Yeah, it is, because they're all there.
That's it. So catch them at the barbers. And
You know, that's what we used to do when I used to work with Terence Higgins Trust.
brilliant.
We used to go to the barbers and even to the hairdressers
Yeah.
to do
Yeah.
HIV testing.
Yeah, so it makes sense.
It
So,
does.
so if someone was very proactive in their community, what they could do, they don't have to be a doctor to do this, they could speak to the health authority, say, look, could I introduce this at my local barbers, and then set up that network. So
I
that's
like
being
that.
proactive.
I like that. So if you're a barber, please go and speak with the health authority. So at least you can offer the services to the men that come to cut their hair in your barbers. Please do that. Now, another thing that I want to touch on, another question actually before we move on to diabetes, which of course you've already answered, but I'm going to ask anyway. Mike wanted to find out whether the test, the physical test is painful.
Right, sure. So having a finger in your rectum, in your bottom actually, depends on you, right?
Yeah.
Some people, and it also depends on the doctor, interestingly enough.
Okay.
If your doctor is a short Asian lady who's skinny, she's got short, skinny fingers. If your doctor's a 6'4" guy who plays rugby, then he's got big, stubby fingers.
Yes.
So it's all relative.
So it depends on the doctor who is
Absolutely.
actually performing the test.
That's it. That's it.
I like that.
Yeah.
Man, listen, I know this test sounds horrible, but you need to do it. Because according to the NHS, actually, over 40,000 new cases are diagnosed every year.
That's right, yeah. And as we said, there's a nuance between types of cancers. So one type is very slow growing, but you still need to know that you have it.
Of
that
course.
type, you don't need aggressive treatment because it's
Okay.
very slow growing. The other type that's fast growing is significant. And by the way, a friend of mine, a lovely man called Alfred Samuels, he suffered from prostate cancer. He went through chemotherapy, radiotherapy, everything, and he's written a book about the subject. So if you Google Alfred Samuels prostate,
Alfred Samuels.
then
Okay.
that should come up.
Thank you very much. Thank you. Now we are going to move on to diabetes.
Sure.
And I thought we focus on type 2.
Yes,
because
of
that's
course.
more lifestyle.
That's right, yeah.
And I know it affects a lot of, not only, mainly Afro-Caribbean
Yeah.
men and women as well.
Yeah, that's right.
You know.
Yeah. Well, you mentioned the difference. So diabetes mellitus, which is what we're talking about, is sugar diabetes. So this is diabetes where your blood sugar is out of control. In the old days, they used to make the diagnosis by tasting your urine because there was sugar in the urine, so it tasted very sweet. That's essentially what diabetes mellitus means. Now, the problem is that as you get older and our lifestyles change, especially with processed foods, obesity, then the incidence of what we call non-insulin dependent diabetes has gone up and up and up. And we as a community do need to do something about this.
We do.
I have a theory about African men.
Okay.
Now, a lot of African men are very proud of their pot belly. And I think it was a cultural issue around riches. So the idea was to show that you were wealthy.
You have to have a pot belly.
Exactly,
I know.
right. So I think we need to get rid of that mindset
Yes.
in today's day and age. And we need to say, right, your waist measurement is important and keep it as low as you can.
And what's the recommended weight measurement?
Yeah, and waist, I think 32, 34 is about
32,
reasonable.
34, okay.
If you're getting into 36, 38, you're already in trouble, both from the cardiac level and at a risk of what we call pre-diabetes. So people need to think about that.
I was actually reading an article, a couple of physicians say that they shouldn't actually tell people if they're pre-diabetes because it worries them a lot. Do you agree with that?
It's a hard one to say. I think you don't want to create worried well people, clearly, but you do want to warn people that they're heading in the wrong direction.
So they can take measures.
Exactly. So good medicine is signposting. So if I'm giving you the signpost, look, danger over there, then...
Of course, I'm going to avoid it.
I hope you will. Anyway, I hope you will, yeah.
So what are some of the symptoms?
Yeah, sure. So thirst is one of them. So excessive thirst. So people with severe high sugars, they just keep drinking and they want particularly sugary drinks. So if someone's knocking back lots of Coke, Fanta, this, that, the other on a regular basis, that's a really good sign that they might have diabetes.
So thirst is one of them. The
Thirst
second
is one of them. Excessive urination, so you're peeing a lot. And the other one can be that your breath starts smelling a bit foul.
Actually, now that you've mentioned that, there's actually somebody I know.
Oh, right, okay.
Yeah.
Same thing, yeah.
Yeah.
There's a thing called, you produce ketones, and you can smell those on the breath. And then in some cases, it leads to weight loss, but that's at a late stage.
At a later stage.
A lot of people are very fat at the time that they are diagnosed.
So weight, of course, is an issue.
Yeah.
And how about the foot problem? Because I know a lot of people actually kind of begin feeling numbness on their feet.
Yeah, so one of the consequences of untreated diabetes is damage to the nervous system. And you'll describe what we call a peripheral neuropathy. So this is damage to the nerves in the peripheries of the body, whether it be the hands or the feet. And the feet are crucial in diabetes. So once you know you've got diabetes, this is the time that you need excellent foot care. So we always advise someone, once they've got a diagnosis of diabetes, not to cut their own nails. This is important.
True.
Because what happens is you cut your own nail, you cut a bit of skin. Because you've got a lot of sugar in your bloodstream, the bacteria love that. So then you get the infection. Then that leads to the point where in some cases we actually have to amputate the person's leg. So anyone with a diagnosis of diabetes should not be cutting their own feet. They should be under a diabetic foot nurse or a specialist who can do. The other reason that's important is that when you get diabetes, another risk of diabetes is problems with your eyes.
With your eyes, yes.
Because what happens is you have the retina, which is almost like the back projector of the eye. And the way to think of it is like that starts developing holes in it. That's a simple way of describing it. Oh. So then your visual acuity, your ability to see things, declines. So you imagine now you've got poor eyesight, you're trying to cut your toenails. It's a bad combination.
It is.
That leads to problems.
We are going to take a short break and we'll be back and then we'll take on from there. So if you know anyone who would be interested in this, please do call them. See you in a bit. Thank you. Maybe after the break we can... Thank you so much and welcome back. I hope you've grabbed yourself a cup of tea. Now, Dr. Easmon has touched on prostate cancer and he's also touched on diabetes. So if you have any question, please do feel free to either text or you can call the studio line, which is actually at the bottom of the screen, and ask any question and we'll be able to help. And I would really encourage you to go and see Dr. Easmon. And he's at the iconic address in London, which you can't even miss. Number 1 Harley Street. I visited him yesterday. So please do go and visit him. And you know what? He's such a passionate doctor. You need to go and see him in his office if you have any problems at all, and he will address it. Now, another thing that I wanted to touch on, Dr. Easmon, is sleep problem.
Yes, absolutely. What we know is that most people in Western society are not getting enough sleep, full stop. So you need
I'm a victim.
Yes, exactly, and you're not alone. In fact, Professor Matthew Walker has written a recent book called Why We Sleep, and this book is excellent. But it reinforces.
I need to make a note of that.
Yeah, that's
Professor
right. Matthew Walker.
Matthew Walker.
Yeah,
Okay.
Why We Sleep. It's in paperback now.
Okay.
Well. So the point here is that he reminds us that, you know, as a human being, sleep is an essential part of restoring our brain. And without inadequate sleep, you become more tired, more confused, less able to concentrate. It has physical effects on your health. And interestingly enough, if you don't sleep enough, you put on weight. And what seems to happen is that when you don't sleep enough, a different hormone is released, and that hormone wants you to take sugary things in.
What's the recommended hours of somebody to sleep?
Yeah, at least 6 or 7 hours.
6 to 7 hours.
Everyone is different, by the way.
Yes.
And it's also about sleep quality.
Yes.
But I think most people are about 6 or 7 hours.
6 to 7 hours.
Yeah.
I need to start getting in my 6 to 7 hours sleep.
And the other thing we talk about is sleep hygiene.
Yes.
So what we advise people to do is not to look at screens at least an hour before they're ready to go to sleep.
Okay.
Not to do work at least an hour before they're going to sleep.
So what would you recommend they do?
Read a book,
Read
actually.
a book,
And not
okay.
even on a Kindle, but read a book,
proper book.
paperback book or a thing like that. Listen to music or something like that to
Yes.
relax the mind.
And another thing I want to touch on with regards to sleep is the sleep apnea.
Yes, big issue.
What is that?
Okay, so that means problems with sleeping that you wake up, even you're not even conscious that you've woken up because you've got an obstruction that leads to that. So it may
And
be.
where is the obstruction?
Okay, good question. So it could be the sinuses itself, it could be polyps in the nose, or it could be the fact that you've got obesity that is contributing to what we call tracheal obstruction. So people with sleep apnea tend to be snorers, especially if it's an obstructive cause, and also they tend to start in the middle of the night because their breathing is compromised. Now that is causing longer term problems, and they need sometimes a treatment called CPAP, which is continuous pressure air ventilation, and that's a mask that they wear at night that ensures that they don't get short of breath at night.
And what would the map to the thing that the mask that they wear, what would it do? Would
Yeah,
it
so
cause
basically
anything?
it positively pushes the air into their system. It's called CPAP.
To help them sleep.
They help them breathe better while they're sleeping, and then
Okay.
that helps them sleep.
And how long would they wear that for?
All night.
Okay.
It's not the most
For
romantic.
the rest of their
it's
life?
not the romantic thing in the world.
Not at all.
But yeah, in many cases, I mean, if someone started CPAP and they were obese, and then they became no longer obese, they may not need the CPAP after that.
You know, is it the same? I'm trying to understand. Is it the same as somebody, because when somebody's sleeping and they kind of go like for a minute and a half without breathing, they
Yeah, that's
like holding their breath.
That's right. So it's a similar thing to that. So it's the fact that they're not getting enough air through their system at night. Yeah, it's an obstruction.
That's dangerous, you know.
Yeah, of course it has.
And
long-term
I
effects.
suppose it could actually put a lot of pressure on their heart.
It does. Yeah, it leads to earlier heart disease as well.
Ooh. Now, listen, women, ladies, if your partner is suffering from any of the symptoms that Dr. Easmon has mentioned, please do encourage him to go and have a test, because you do not want your partner suffering from any heart issues or any kind of problems at all. You know, the most important thing is just encouraging your partner to go for a test. It's very important. You know, health is wealth. If you don't have good health, you can't be wealthy. So look after your health, right?
Yeah, I would agree entirely. And you know, the thing in the UK, we don't want all our men to just work, retire, and then collapse.
No, we don't want that.
Yeah, we don't want to see gone too soon anymore.
No, we don't want gone too soon. Dr. Easmon, you know, I've really enjoyed this conversation. But another thing that I wanted to touch on, if you could go back maybe to the diabetes, yeah?
Yes, of course.
Because a couple of people actually I was talking to, and they mentioned that they were really scared of being told that they had diabetes, that they do not want to go for the test.
Right, okay. Well,
how would you encourage?
Yeah, it's interesting because fear is a real blocker to progress, right? And we all have to face our fears at some
absolutely,
point.
absolutely.
And the thing is that if you get a diagnosis, it actually helps you because you can go to the next level. So there are charities like Diabetes UK, who
yeah.
have very good information. I think maybe setting up a communal discussion group, talking to somebody who's had it. I mean, obviously, if you just Google things, it scares the hell out
Of course it
and you don't want to go anywhere near it. But the point is that if you talk to somebody who's knowledgeable and can give you sensible information, then at least you can deal with the issue. But deal with the fears, whether it's on a communal basis, an individual basis, talk to friends, talk to family, look at the relevant charities and ask for help.
Yeah, there's a lot of help out there as well. So please don't let fear hold you back from having good health. Do speak to somebody out there. I was just thinking about the sleep issue because I think I watched a documentary once where, no, actually not a documentary, in the community where I work. And the first time that I saw the CPAP, and the guy was actually wearing, and like you said, it's not very romantic.
Oh yes, of course not. No.
But what I wanted to find out, do you wear it, do you use that for life?
In most cases, probably yes. As I said before, if you started obese, you use the CPAP, you manage to lose weight, by the time you've lost weight, you may not need the CPAP anymore.
You may not need it. You won't have any operation though?
No, I mean, the nice thing about CPAP, I mean, the device is privately, I think it's about £500. Don't know, obviously on the NHS you probably don't get a charge. It's a simple device, you just plug it in, you put the mask on, and you go to sleep. I mean, some people wear a face mask at night. Some people wear those blinkers on their eyes. So once you get used to it, it's no worse than that, to be honest.
Absolutely. You know what? I wanted to look through the camera and please just speak to our viewers.
Yeah, sure.
On the three.
A lot of us grew up with the principle that we should eat everything on our plate. The only problem is there's more food on the plate and more of it is processed. So I think leave half the plate behind.
Or more vegetables.
More vegetables, indeed, indeed. And then on the sleep side, make sure you're getting adequate amounts of sleep. And if you are storing heavily and people are telling you that, seek help from your doctor because you may need further help for that.
And how can people get in touch with you?
Yeah, sure. So we have a clinic based at Harley Street. The website is yourexcellenthealth.co.uk. The telephone number is 0207 580 5467.
And you offer every kind of treatment there?
Well, we do health screenings and we do occupational health. I have to be honest, I'm not a general practitioner. Some of those cases I refer to colleagues in Harley Street, and also the advantage we have is we know all the specialists in Harley Street. So whether you have a problem that requires a neurologist, an endocrinologist, we can refer you on to the relevant people.
And it can actually speed up the process as well, isn't it? Because you get to rely on the NHS.
Let me tell you a funny story. I had a client who wanted to see a cardiologist, and I contacted 4 of my cardiologists. One came back 1 hour later, and I said it was already too late, because by then we'd already found a cardiologist for the patient, within 1 hour.
So he's the source of every information that you need. Every doctor in the UK, you speak to Dr. Easmon, he'll be able to refer you to any specialist, whatever kind of ailment that you're suffering from. Dr. Easmon, thank you so much.
Linda, thank you very much.
And I hope you'll visit us again.
I will look forward to it.
On the show. And sorry for getting lost.
No, that's
coming on the show.
That's fine.
I know you braced the rain, but thank you so much.
Pleasure.
Thank you. Now, ladies and gentlemen, you know what? Health is very important. Sometimes we take it for granted. We are working 24 hours and we're not really listening to our body. When your body is telling you something, please go and seek help, because you only have one body. And if it's not healthy, it's not right. You need to do something about it. Ladies, I really encourage you, whether you're dating, whether you're married, or whatever it is, whatever kind of relationship that you're in, please do encourage your partners to go for tests, to have the test done. Well, maybe the rectum test might be a bit... That's what put a lot of men off.
I know.
But there are alternatives, okay?
There are alternatives.
Yeah, that they can do. But I encourage you to please do take care of yourself. Now, I'm going to have another guest coming on the show immediately after this, but it's going to be a pre-recorded. It's a young entrepreneur, 9 years old. I'm just looking forward to chatting to this lady, to this young girl. She is just exceptional. And I would encourage you, the parents, if you know a child or you know your child alone, try and identify the gifts and the talents that they have and nurture it. Because the generation that we were brought in, we were not nurtured. The talents that we have were not nurtured at the early age. So if you have a child that is actually exceptional in either music, dancing, singing, even speaking, or even writing a book, do encourage them and get some professional help whereby your child can flourish in whatever giftings that they're in. I look forward to seeing you again next week. And thank you so much for tuning in. Remember to share my page. Go onto my page, and you can find me on LinkedIn, YouTube, Instagram, Facebook, all the social media links. I am there. And I'm your girl, Linda Muyobo, wishing you all the best that you can have. Until next time, God bless. Bye-bye for now. And bye-bye. Things that we've touched.
Yeah. So I think the appeal is really for men, especially Afro-Caribbean men, to get knowledgeable about prostate cancer, look up charities like Prostate Cancer UK, support charities like Black Cancer Care, which my friend, the urologist, Dr. Frank Chinagunda, helped set up, and also have your PSA checked on a regular basis. So one result is not enough, it's a trend that's important. In terms of blood sugar, if you think you're drinking excessively, especially sugar drinks, you're peeing a lot, again, that might be a clue to diabetes. And if there's a family history of diabetes, that might be a further clue. If your waist size is too large, I'd say above 36, certainly start thinking about reducing it by doing more regular, gentle exercise and thinking about portion control.